Do you know how crucial Pap smears are for cervical cancer screening? If not, you're in the right place. A Pap smear, also known as a Pap test, is a simple procedure that involves collecting cells from your cervix, the lower, narrow end of your uterus. These cells are then examined under a microscope to look for any abnormalities. But why is this so important, you might wonder? Well, these cervical cell changes may signal the presence of precancerous cells or early-stage cervical cancer. Detecting these changes in their earliest stages is vital, as cervical cancer is often preventable with regular screening tests and follow-up care. So when we talk about prevention and early detection of cervical cancer, the role of Pap smears is paramount. Their importance cannot be overemphasized, and they are a vital part of maintaining women's health. Now that you know what a Pap smear is, let's delve into why it's so important. Why are Pap smears important? Simply put, they save lives. Now that's not an overstatement. Pap smears are a critical tool for early detection of cervical cancer, a disease that can be prevented if caught in its initial stages. Let's delve a bit deeper into this. Certain factors can increase the risk of developing cervical cancer. These include being infected with the human papillomavirus, commonly known as HPV, having multiple sexual partners, and smoking. It's a bit of a scary list, isn't it? But here's where Pap smears come in as our superheroes. These screenings are designed to detect any abnormal cells in the cervix that could potentially lead to cancer. That's why they are so crucial. They can spot the trouble before it becomes a full-blown problem, allowing for early treatment. Imagine it like this. You're on a road trip. A Pap smear is like your GPS, guiding you and alerting you of any possible roadblocks or detours ahead. It's your early warning system, helping you navigate and stay on the safe route. So by now, you might be thinking, okay, I get it. Pap smears are important, but how often do I need to do this? Knowing the importance of Pap smears, you might be wondering how often you should get screened. So, how often should you get a Pap smear? The answer depends on your age and health history. Now, for sexually active individuals aged between 21 and 65, it's typically recommended to get a Pap smear every 3 to 5 years. However, the type of test available may vary depending on your age and risk factors. For example, if you're over 30, you might be offered an HPV test along with your Pap smear, as the risk of contracting the virus that can cause cervical cancer increases with age. If you're under 30, don't worry. Your healthcare provider will let you know which test is best for you. It's also important to note that abnormal results may necessitate further testing, like a procedure known as a colposcopy. But keep in mind, not all abnormalities indicate cancer. Sometimes, they're just a sign that your body is fighting off a minor infection or you have an imbalance in your vaginal flora. Remember, regular screenings are essential for women's health, and preparation is key for accurate results. So, keep up with your health checks, ladies. It's one of the best ways to ensure you stay in the pink of health. In summary, Pap smears are a powerful tool in the fight against cervical cancer. They serve as an early warning system, detecting abnormal cells that may, over time, develop into cancer. This preventative measure is crucial for all sexually active individuals aged between 21 and 65 and is recommended every 3 to 5 years. It's important to remember that factors such as human papillomavirus or HPV, multiple sexual partners, and smoking can increase the risk of developing cervical cancer. Therefore, alongside regular Pap smears, HPV vaccination plays a significant role in cervical cancer prevention. However, even if you've been vaccinated against HPV, Pap smears remain necessary. The vaccine protects against the most common types of HPV that cause cervical cancer, but it does not protect against all types. So let's take a moment to emphasize again, Pap smears are essential. They are our first line of defense. If you haven't had one recently or ever, it's time to have a conversation with your healthcare provider. Ask about when to start and how often to get screened. Keep in mind that preparation is key for accurate results, so follow your doctor's instructions carefully before getting a Pap smear. Abnormal results may require further testing like a colposcopy, but it's crucial to understand that not all abnormalities indicate cancer. Many changes in cervical cells are caused by the HPV virus, and these changes may resolve on their own. In conclusion, regular screenings are not only essential for women's health, but they are also a way of taking control. They give us the power to prevent and fight cervical cancer. Thank you for taking the time to learn about Pap smears and their role in preventing cervical cancer. Knowledge is power, and we hope this information empowers you to take charge of your health. Remember to subscribe for more educational content. Take care and stay healthy.